My question is to the Minister of Health and Long-Term Care. As I'm sure you're aware, prescription drug abuse is an epidemic in northern communities. In my riding, the community of Cat Lake has declared a state of emergency as a result of prescription drug abuse. Other First Nations communities report addiction rates as high as 50 to 70%. On Friday, it was announced that Oxycontin will no longer be available in Canada. While this should help prevent further addiction, it does little to help those who are currently addicted. What is this government's plan, and does this government have a strategy to assist First Nations communities struggling with staggering rates of addiction?
Thank you, Minister.
Speaker, thank you to the member opposite. She's raised a very, very important question. I think the members of this House know that the issue of prescription drug abuse, and particularly Oxycontin, is one that has taken a significant amount of my personal time, because I do know that we've got a lot of work to do. We know that Oxycontin will no longer be manufactured by Purdue Pharmaceutical, that there is a new drug that is far less likely to be used for illicit purposes. Speaker, we do have an issue that we are working to address, Speaker. The federal government, of course, is responsible for delivering health care in those First Nations communities. But, Speaker, this is an issue of concern, and I want to assure the member opposite that we are looking into it.
Thank you. Supplementary.
First Nations communities have been asking for help for years, but their requests have fallen on deaf ears. Minister, First Nations people are citizens of this province, and they're crying out for help. Leaders in the North are terrified about what may happen if entire communities are forced to go off the drug cold turkey. Time is of the essence. When will this government release a comprehensive plan?
Good question. Minister.
Speaker, we released our strategy, our addictions and mental health strategy several months ago. Part of that strategy, Speaker, is dealing with this addiction of prescription narcotics. Speaker, there is much work to be done. I am very well aware of that. And I want you to know, Speaker, that we are very much focused on this issue.